Hello everyone, welcome. Today I'm going to be taking you through a different medical condition that affects many females. It's called vaginal itching. Vaginal itching has several causes. So knowing exactly what causes the itches is already the beginning of getting a relief for the vaginal itches. Now, there are bacteria-caused itches. There are also yeast cell infection caused itches, and there are itches in the vagina that can be caused by chemicals that ladies use, such as soaps, detergents, and douches that some ladies use. All these chemicals can cause what we refer to as contact dermatitis. That means when these chemicals come into contact with the vagina, they can cause irritations inside the vagina, and such irritations can result in contact dermatitis. There is another cause of itches in the vagina. For instance, when the immune system is compromised, your immune system is compromised when your level of white blood cells are diminished, maybe by the presence of a particular virus, like the HIV virus. So the HIV virus affects CD4 cells, affects the immune system, the disease-fighting system in your body. When it affects the immune system, it reduces the white blood cells, which are also referred to as soldiers for fighting infections. So when these soldiers are limited in the system, the probability of getting certain yeast infections is very high. So there is an overgrowth of yeast cells in the vagina as a result of a compromised immune system. So another cause of itches in the vagina can be menopause. And menopause is a period where a woman can no longer reproduce. She has become infertile due to hormonal suppression. Now, there are certain hormones that are very important in the reproductive system of a woman, such as estrogen. This is a hormone that helps in the thickening of the vulva and the vagina, and also makes the tissues around this area to become elastic. When this happens, it prevents itches in the vagina. So, during menopause, the production of estrogen diminishes, and these low levels of estrogen results in the thinning, or the tissues around the vagina and vulva become so thin, resulting in itches. When they become so thin, they become also dry, and some ladies during sexual intercourse, they experience pains or some burning sensation due to the dryness, which is caused by a drop or reduction in the production of estrogen hormones. So this could also be another cause of itches in the vagina. Now, bacteria cause of itches in the vagina. There are several bacteria that are pathogenic that can cause itches in the vagina. We are talking about bacteria such as Gardnerella vaginalis that can result in bacteria vaginosis. So bacteria vaginosis is when there is an imbalance between the good and the bad bacteria. Now, the normal flora of the vagina is referred to as the good bacteria because they are there to maintain a balance with the yeast cells that are found in the vagina. Now, yeast cells are supposed to be found in the vagina. They call them the normal flora. The problem is when there is an overgrowth of these yeast cells that are normally found in the vagina, it results in itches in the vagina, and these itches can lead to the production of more discharge, which is mostly whitish. It could have some smell as well as it might not. So some vaginal discharge due to yeast cell infection overgrowth can have a fishy odor, as well as some might not. Now, there are certain conditions such as eczema that is mostly common in people that have an allergic reaction that can cause certain patches around the genitals of a female. When the word vagina is used, some people can use it interchangeably with the vulva, but they are different. The vagina is the inner part of the vulva, while the external part of the vulva comprises of parts like the clitoris, the labia, and the urethra. So, but itches can affect either of these parts I've mentioned. If you know the exact cause of the itches, then you'll be able to get a relief. For instance, if it is a bacterial vaginosis that causes the itches, antibiotics are going to be prescribed for you. And make sure that you complete the course of antibiotic treatment, even if you start feeling better within a short period of time after starting the antibiotic treatment. Make sure the antibiotic treatment is completed. Now, if the itches is due to yeast cell overgrowth, that means fungi, Candida albicans, you will be prescribed some antifungi, either creams or gels that you will insert in the vagina, or oral antifungal drugs that will help you to clear off the overgrowth of the infection. Now, there are certain STIs or STDs such as syphilis, chlamydia, gonorrhea, genital herpes, genital warts that can also result in itches in the vagina. So the cause of the itches is very important or primordial in handling or relieving you of the symptoms such as these itches. Now, when you're prescribed antibiotics, if the itches is due to an STI, if you're a couple, if it's a couple, then they advise to take the treatment together, such that you shouldn't treat yourself and then get it again from your partner. Now, there should be no sexual contact in the course of treatment if the itches is as a result of some STIs such as the ones I just mentioned, like chlamydia and syphilis and the rest. So this video was just to help you to try to know what is going on with your genital, especially for females. Avoid using certain irritants or chemicals frequently that can alter the vaginal pH or the degree of acidity or alkalinity of the vagina, leading to overgrowth of normal flora, which can lead to itches. Also, make sure that you visit a medical laboratory in case of itches to make sure that the exact cause of the itches is discovered and the correct antibiotic or antifungi, depending on the cause of the itches, is prescribed to you. Until next time, stay glued to our channel.